Hi, I'm Joe Calderoni, Senior Vice President for Communications here at Mount Sinai, South Nassau. I want to welcome everyone in our Facebook audience today. Obviously, we're in the middle of the COVID-19 crisis, and we're trying to keep the community informed of what's going on here at Mount Sinai, South Nassau. Today, we're very delighted to have with us Dr. Alan Garley. Dr. Garley is the chairperson of our OBGYN department. He's also a professor at the Icahn School of Medicine at Mount Sinai, and he is in charge of all of our OBGYN care and maternity care and labor and delivery here at our Oceanside campus. So Dr. Garley, thanks again for taking some time today to be with us. Recently, this week, we instituted a more restrictive visitor policy for mothers who are about to give birth. We are only allowing the mother themselves and no one else in the room because of the COVID-19 crisis. I'm a father of 3. You're a father of 2. I was at all 3 of my children's births. I know you were. It is the most spectacular experience you could ever hope to witness. I know you feel that way too. What was the rationale for this new, more restrictive policy?
Joe, this was probably among the hardest decisions that I have ever had to make in my career, and it wasn't made just by me. It was made in consultation, in conjunction with my team here at Mount Sinai South Nassau, but also with my larger team and the Mount Sinai Health System. That includes Mount Sinai on the Upper East Side, Mount Sinai West, which is the old St. Luke's and Roosevelt, and the obstetricians, the perinatologists, the neonatologists. So
the entire system, 8 hospitals.
System. And we came to this conclusion after having a discussion with the leadership at Columbia and Cornell, at New York Hospital, and at Columbia Presbyterian. And they had compelling reasons for implementing this policy, and we agreed. And since we're the leading medical schools in the country, we felt the science was strong enough, and that the goal for us is to achieve one thing and one thing only, which is a healthy mother and a healthy baby. And by putting these practices into place, we believe that along with Columbia and Cornell, we are now the safest hospital to deliver a baby in New York.
So
period.
Just explain to us a little bit, because I'm a father or a significant other, and I want to be in the room so badly for the birth. Explain, if you would, why is it safer? Why is this the safest thing to do?
Because right now, none of us knows who's positive with the virus and who's not, unless, of course, they've had a test that shows that they're positive, in which case they're secluding themselves, they're quarantined. If they're negative, we still don't know that they're actually negative because people convert to being positive after the test. By eliminating all the visitors in labor and delivery and postpartum, we've cut your risk in half. That's 1 less person per pair that can infect you or your baby. Everybody thinks that they're healthy until tomorrow when they're not, and we don't know who's healthy and who's not. Additionally, if we don't protect our workforce, our nurses, our techs, the people that clean the operating rooms, the people who clean the rooms, our doctors, if any of those people get sick and start going out, we will have nobody to deliver anybody's baby safely. Obstetricians can't be made overnight. It requires a lot of training to make somebody a really skilled obstetrician and a skilled labor and delivery nurse and postpartum nurse. These are highly skilled areas. And the other thing is, you must be aware that we have a major resource problem in all of the hospitals. We have difficulty getting N95 masks and gowns.
You're talking about personal protective equipment like the surgical mask that's around your neck. Right. These are in very short supply right now. If we have to use some of that for the partner, that's less we have for healthcare workers.
Absolutely. This mask is not an N95 mask. This is not the mask that we're allowing our doctors and nurses to go into labor and delivery with. We have had to beg, borrow, and steal to get the masks for them. Only yesterday
the
did
N95,
the N95.
Just for people who are unaware of what that means, the N95 is a more expensive,
much more,
tighter fit.
And it filters 95% of the air that you breathe. It's
and those are in shorter supply than just the regular surgical mask.
Much shorter supply.
Right.
The price of those masks have gone typically from 75 cents to $1 up to $7 a mask, if you can find them. So for us to put those masks on visitors, those are masks we don't have.
Right. I mean, we're literally in a life and death situation during this crisis, no question. I just want to get back for a minute to the decision to not allow anyone else in the room.
Correct.
So the person you mentioned, the visitor, the partner,
Correct.
could have no symptoms.
Correct.
Not even a sniffle.
Nothing.
But as far as we know, they could still be carrying
Absolutely.
and spreading
Correct.
COVID-19.
We also know from studies done when the SARS epidemic, which is also a coronavirus, that it does not spare babies. And so we expect this virus to behave exactly like other coronaviruses. We are doing this to make the labor and delivery experience safe because we have one goal and one goal only. That goal is for every mother, for every family to take home a healthy mother, but more importantly, in addition to the mother, is taking home a healthy baby. And this is what we are doing to guarantee to the best that we can that that occurs.
Now, you mentioned the baby. The mother, after you give birth, you're a little bit compromised. Is there a greater risk to mothers postpartum?
Well, there is a concept of that the birth process and the pregnancy process can make you a little bit immunocompromised and a little more sensitive to infection. And so just going on that concept alone, anything we can do to mitigate infection is where we want to be. Good.
So we talked at the very beginning that how special it is to be there with your spouse or your significant other during the delivery. We don't want to lose that as much as we can, even
Correct.
though we're no longer allowing significant others in the room.
Correct.
We have come up with a solution. We're in the digital age, so we are going to be supplying every labor and delivery room, every expectant mother with a digital delivery option, right? And we have an example here for our audience just to see of what it's going to look like. We have a nice adjustable stand. We have Gretchen in one of our labor and delivery rooms now. Yeah, wave again so they see you're live with us. And this will be the angle. You can adjust the angle from inside the room. And of course, this is your option. This is the option of the mother, whether they want to take advantage of this or not. But if they want to take advantage of it, we're offering this digital delivery option to all of our patients. I believe we ordered 50 new iPads just for this purpose.
And this is also for postpartum, not just for in the labor and delivery room. I can't stress enough, we're not trying to make it so that this is just as good as a delivery. We know it's not. But this is what we're trying to do to accommodate an incredibly difficult situation and a dangerous situation. And it's the best we can do. It's the closest we can give you to experiencing a real delivery and being there, with your loved one while she's giving birth.
And also, I was speaking to the head of our IT department, who's a terrific guy, who's helping us set this up. And according to Matt, you can also FaceTime on this. You can communicate. So after the birth, of course, you always love to have a lot of relatives be part of the birth experience. So you can hop on this. We have Wi-Fi in the hospital and in each room. You can communicate as much as you want with as many relatives and friends and loved ones as you wish using this device.
And we're also doing this in the C-section rooms too. So we're trying to make it available for every moment that you're here in the hospital. We want you to have experience as close as a virtual reality as possible.
Very good. We mentioned the PPE, so there is a little bit of a different policy in the NICU.
There is. In the NICU,
and just tell people what a NICU is.
A NICU is the neonatal intensive care unit. That's where babies need to go when they need a little extra special attention and care. Sometimes babies that are born a little young, or babies that are born to mothers that have had medical problems. This is where the baby is sort of monitored 24/7 by a team of specially trained nurses and doctors, pediatricians. And in those cases, of course, we don't want the baby to be alone. So we do make an exception for a mother to come and spend as much time 24/7 with the baby as needed. Additionally,
I mean, those babies are in an isolation unit.
They are. And we also are making accommodations in this hospital for anyone who is experiencing a moment where they're near the end of their life. We'll allow a visitor and also in the sad situations when someone has a miscarriage or they have a stillbirth. Those particular instances, we will make an allowance and have a visitor with them because that's a special time.
Now, I know that this was a difficult decision, but
Terrible.
It's one that you believe in firmly. I know that you've been rounding on the labor and delivery unit. You've been talking to the mothers who are here.
Yes, Joe.
Just tell us a little bit about that experience.
Yes, so at least once or twice a week I make rounds on every postpartum patient in the hospital. And this morning, of course, we put this rule into effect at noon on Monday. And this morning I made rounds on about 12 of our postpartum patients and asked them what they thought of our rule and how they experienced it and what they thought. And without exception, every single one of the women told me that they were, of course, devastated and unhappy and not pleased with the decision to have no visitors during their labor and their postpartum. But also, without exception, every single mother told me that she thanked me, and she thanked me for making this hospital the safest environment for her and for her baby. And it was really assuring to me that I know in my heart we made the right decision and we're doing the best thing possible.
So we are taking some questions that we're getting as a result of this Facebook Live feed. Thank you for sending in your questions. Thank you for taking some time to be with us today. So one of our folks on Facebook is saying, if I have more questions, what do I do? Should I talk to my physician, my OBGYN?
The best place to start is with your OBGYN, because at this hospital, our entire OBGYN department is like family, and we are constantly in communication. I send out bulletins on a regular basis. I know every obstetrician here very well. If anyone has a question that they can't answer with their patients, they will pick up the phone and call me, and I will have the answer for them right away.
So what about, giving birth can be an experience, sometimes a traumatic experience, usually a great experience, but the mental health of the mother, this is a question from one of our Facebook audience members, who will handle the anxiety of the mother if they're having extra stress?
Labor and delivery unit is staffed by some of the most experienced, caring nurses that exist on the planet. Up at Mount Sinai South Nassau. Every single one of them, without exception, will be there as extra hand, extra person to give you support. We will not leave one person in distress. And plus, with the virtual abilities here, you'll also have your own partner, and you can have as many family members as you want on your device. So you're not going to just be limited to the support from one person. You'll have support from as many as you want. But I also want to stress the visitation policy is that we're making no exceptions. And I want to put that out there as clear as possible. I've been asked by doctors in this hospital if they can come in, because they're on staff here, if they can come into the delivery room, and the answer is no. I've been asked by nurses. The answer is no. What's good for one is good for all. There are no exceptions to this rule.
Now, we do have another question from Allie. So what if the mother is COVID positive? Is there, how do we deal with that?
So we are not going to deliver those patients and jeopardize them in a separate area. We are going to designate an area in the delivery room that is specifically for COVID positive patients. We're going to have an air filtration system in the room to clean the air constantly. And if they have to go into an emergency section or a scheduled operative delivery, we'll have a special room. We have a special room set aside for that. So no one that delivers here needs to worry that they're going to be placed in a room that's going to be contaminated by a previous COVID positive patient.
And do we know if the virus can be transmitted from the mother to the fetus?
There are no studies as of yet that are confirming that, but this is all an ongoing process. And so far out of China, I think there were 2 cases where they believe there may have been maternal child transmission, but it's not been substantiated right now.
All right, so no scientific evidence yet?
Not yet.
Okay. But of course, if the mother is positive, that whole room, we're treating the whole room appropriately.
100%.
Right.
That room needs what's called a terminal cleaning, and we have special ability to do that, just as we're doing with all the other COVID positive rooms in the hospital.
All right, this question comes from Katie, one of our Facebook viewers. What if only my husband knows the birth plan? Can he communicate that plan with the doctor?
100%. He can communicate it with the doctor, with our nursing team. We will go above and beyond to make this the most memorable and absolutely spectacular delivery that you ever could have planned, short of being there.
Right. We should mention one other thing, in case there are some moms out there who don't know. Mount Sinai South Nassau has only private rooms in our labor and delivery maternity unit.
True, and we have no plans on doubling them up at this time.
Right.
So we are asking our patients, if they're up to it and they're healthy, to have a discharge a little earlier than they normally would. And so far we're not getting any pushback from any of the patients, because most of them know that probably being home with your family is probably the safest place you can be right now.
All right. Unless we have we have one more question coming in. Okay, let's see. Another question. This is our last question. Why are we the only hospital on Long Island so far that has instituted this policy?
Well, I asked all the other chairmen on Long Island of OBGYN departments to join us in this initiative, and I'm actually happy to announce that Good Samaritan Hospital Medical Center in West Islip has also agreed as of today to institute the policy. It remains to be seen if the other Catholic hospitals will follow. Stony Brook so far is not agreeing.
I mean, we can only really speak for our institution.
But all I can say is they know what we've done, and I'm happy that Good Samaritan has come around and is in agreement with us, and I really praise them for that.
So just to sum up, the reason why we're doing it, the reason why you decided that this was necessary, again, the reason is?
It's the safest option for the baby and the mother, period.
That's the bottom line.
That's it. That's all we care about.
Okay. Dr. Garley, thank you very much for your time. Thank you for watching us, and stay tuned on Facebook Live for additional updates throughout the COVID-19 crisis. Thank you.